Namaste, welcome. Today is day 43 of our 45 days together. I'm super proud that you've been with me on this journey, super honored that you've chosen me to help you. By now you should be seeing some results. If you are where you want to be, then you can continue, no problem, or you can stop. But if you're not where you want to be, do not be discouraged. I'm here as your coach to tell you to keep going. I want you to pick a sequence and do that 3 times a day, or pick any one of the sequences, but do something 3 times a day. You'll see the results and you'll know when to stop. Before we get started, just a few friendly reminders. If you like this video, hit that like button. It helps us to push it out to more people so that I may help them. And also subscribe to our channel and hit that notification bell. So when day 44 gets released, then you'll be right there with us. With that, let's get started here today. Welcome. Get into a comfortable place. You can do this sequence. It's all acupressure today. You can do it inside, outside. If you can do it outside, even better. The vitamin D will help you to lasting longer. The first acupressure point is on the hand, on the forearm. In fact, all of them today are on the hand and the forearm. Before we get started, just a little reminder. If you are pregnant, this sequence may not be for you. You can pick from any of the other 42 sequences and do that. This is a very active sequence, and so if you're not pregnant, please go to a different session and do that. So with that, the first acupressure point is on the forearm. It's on the lighter side of the forearm, or the medial side of the forearm, or the part of the forearm that does not hit the sun. So what you want to go on the medial aspect of the forearm is that you'll simply go from the fingertips all the way down through the wrist to the elbow. We're going to do that for the next 2 minutes. I'm just going to go ahead and put my arm in this position. You do not have to do this while you're doing the acupressure point. You can simply have it laying on your lap and then do the acupressure while you're watching TV. And also you can use the pressure that is most comfortable for you. In my 20 years of experience, I have not seen a difference between firm or light pressure. So do a pressure. You'll know what's right. So keep doing that pressure, and you can do it with the repetition that you want. You can do it fast, or you can do it a little bit more gingerly, as you desire, because you'll find what's right for you, and you can do whichever manner you want. And you can do both hands or left and right. They are bilateral points, so they can help both sides. Why are we doing this? All these acupressure points have many different uses. The purpose of this series is to lasting longer. So this acupressure point specifically calms the mind to calm the body. And so if your cortisol levels are less, then you have more available hormone, whether it be thyroid or testosterone, estrogen, progesterone, FSH, or LH to help you along the way. So I want you to consider doing this acupressure point to calm the mind. A lot of these acupressure points we have coupled with asanas, which have been doubly effective. It's the doubling effect in Chinese medicine. 1 + 1 does not equal 2, but because we're doubling an asana with an acupressure point and so forth, we're getting maybe 1 + 1 = 7. We're getting double and triple the results. So the asana that I want you to couple with acupressure in general is one of 2 things. You can contract the pelvic floor for 1, 2, 3 seconds, lift the pelvic floor for 1, 2, 3 seconds, and you can rest the pelvic floor for 1, 2, 3 seconds. A lot of you have been with me for a while, and so if you would like, you can contract the pelvic floor for 10 seconds, lift the pelvic floor for 10 seconds, and then rest for 10 seconds. And if you can do it for 30 seconds, power to you, but do what's comfortable for you. The next acupressure point is also on the forearm. And again, ladies, if you're pregnant, please do not do this. Select from any one of the earlier series. And this acupressure point is on the apex of the forearm. It's where the lighter skin and the darker skin meet. And I'm going to do this in this position, but you can do it again laying on your laying the forearm on your lap. And what we'll want to do again simply is go from the elbow through the apex of the forearm, through the anatomical snuff box, through the index finger to the tip. So, and again, you can do either hand, left or right. Do what's a comfortable effort for you. And so I want you to continue to do this for the next 2 minutes. And so again, while you're doing this, you can use either forearm. You can also go with firm pressure or light pressure. You can go at a pace that's either gentle or gingerly. Do what's comfortable for you. This point is a great wellness point. You've seen me talk about this point many times. It can help with headaches, it can help with sinusitis, it can help with tension headaches, it can help with toothaches, it can help with back pain, it can help with acid reflux, it can also help you with nausea, it can help you with gas, diarrhea, bloating, constipation. Gentlemen, it can absolutely help you with PE and ED issues. It can also help you with prostate issues. Ladies, it can help you regulate a cycle. It can also bring blood flow to the reproductive organs. Similarly, in helping you last longer, but also nourish the reproductive organs so that it can help you with fertility. If you take only a few things away from me, take away this point. Only if you're not pregnant, you can continue, but if you are pregnant, there are other points you can do. Do not do this point. This is a great wellness point. And the reason why I love this for lasting longer is that it brings blood flow to the lower abdomen, to the pelvic floor. It really nourishes that. And so when it tones the pelvic floor, it gives you more control and stamina in lasting longer. And also simultaneously, because it's such a great wellness point, it can really help balance out the body. So it's not mutually exclusive. You could have back pain and similarly not be able to last longer. Well, this is a great acupressure point for you. It can help balance out the discomfort in the back, and it can also help you to lasting longer. So this point is a great go-to if you're not quite sure what to do. This is a great wellness point, and it can be used on men and women, the young and the old. The only restriction I have is do not do it if you are pregnant. Now, before we step into the last two acupressure points, a lot of times in all of these sessions, I've talked to you so much about your diet and so forth. And one thing I have seen at the clinic, and I saw it here today, is that the gentlemen specifically that are doing any type of seed strategy and or eating nuts in their diet have seen a great improvement with PE and ED issues. Two types of nuts that I've heard and I've seen through empirical evidence, but also the research is also compelling, is walnuts, almonds, and pistachios. So do consider having them and incorporating them into your diet. And then any type of seeds. You can do flax seeds, chia seeds, black sesame seeds, and so forth. And you can eat them just with a little bit of garlic, or you can eat them with masala or chili powder, or you can put it in your smoothies, or you can soak the seeds in water, let the water sit for an hour, and then drink the water. So keep that in mind. And I just want to show you some samples of different types of nuts and seeds that you can use. You can do chia seeds, you can do black sesame seeds. You can also, walnuts are very good. You can do a handful of walnuts daily. You can also do the same thing, a handful of almonds daily. And also patients have reported that they've seen great improvement with pistachios, as well as different types of cashews as well. So keep this in mind, nuts and seeds. Consider doing a handful of them daily. You can either put it in your soups, your salads, or the seeds you can soak in a glass of water for an hour and then drink the water. So with that, let's get started with the last remaining two acupressure points. The next acupressure point is on the darker side of the hand, the side that hits the sun. And so what you want to do, again, I'm doing it in this position for illustration purposes, but you'll basically want to hit the medial aspect of the lateral aspect of the forearm. So basically you want to go to the middle of the forearm on the darker side of the skin. And we're gonna go from the elbow all the way to the fingertip, and we're gonna go back down. And again, you can do this as gingerly as you want, or as fast as you want, as gentle as you want, or as firm as you want. I have not really seen a pattern, so do what's comfortable for you. And then you can also do it on either forearm. Now, in addition to this, we did do an asana. We coupled it with an acupressure point, but I also want to remind you of the visualization technique you can do. For me, I have found equal effectiveness empirically through either the asana of contracting, lifting, and resting, and or the visualization. So when I say visualization, while you are resting and doing the acupressure, what you can do is visualize the blood flow going from the top vertex of the head through the neck, through the spine, through the hips, circling the hips, and then flowing beautifully into the pelvic floor. And every single time I visualize it with you in this series, I really feel the blood flow to the pelvic floor. So the reason why blood flow to the pelvic floor can be very effective is as we're nourishing that area, we can tone that area. And as we can tone that area, then you're going to have greater control and stamina over that area, which is going to help you, gentlemen, with PE and ED issues. And ladies, it's going to help you to climax with more intensity and for a longer duration. So that is why I'm advising you as best as I can to do your best to do the acupressure, to also consider the asanas, and also keep on top of a clean lifestyle with not only diet and rest. So many times in my practice, I don't see people resting enough. Get the 7 to 8 hours of sleep. It can be very helpful so that the cortisol levels are lower, which can help you to have more available hormone to lasting longer. So keep with a good diet and a clean lifestyle as far as rest is concerned. The last acupressure point is on the fist. And again, ladies, if you're pregnant, do not do this sequence. Do not do this acupressure point, as it may be too stimulating for the uterus. So if you're not pregnant, all good. But if you are, please don't do this. This acupressure point, you can simply go fist to fist on top of each other and just simply massage in this fashion. This acupressure point has had so many results for folks. Patients have reported back that not only can they last longer with this acupressure point, but this is such a great acupressure point for gas, bloating, digestion, diarrhea, constipation, nausea. So this is such a great wellness point. This point can also help with toothaches and sinus, headaches, and back pain. So again, there's a beautiful theory in Chinese medicine that it's like a web. We are using the web of acupressure to affect different areas. And as different areas are affected, balances out the body to help you to work your body most optimally. And of course, this acupressure point can bring blood flow to the lower abdomen and the pelvic floor. And that blood flow can tone, nourish, strengthen, allowing you to have more control and stamina over lasting longer for both men and women. Absolutely. And as we have done this series, almost on every session, I have asked you to please check in with your physician. It is very important to me that you work with your doctor. These recommendations or these tips are in addition to the recommendations of your physician. Just because you do this does not mean that you shouldn't see your doctor. You should absolutely see your doctor. Please go see your doctor and layer in these recommendations in addition to what your doctor is saying. Do not replace them without seeing your doctor. See your doctor. And also, we have some free available course materials for you. I've listed out a lot of the diet tips and some of the asanas as well as the acupressure points. And I did that so that you would have some written material so that you can use it as a reference to do that. And you'll also be able to take notes upon it so you can have it long after this series and you can refer to it as life happens. In life, with acupressure, it's meant to be a therapy. You'll know when you need to stop, and you'll also know when you might need to do it a couple of times for a couple of weeks daily until you get the results to where you were. So use it as you need to and lasting longer. Very, very good. I'm so incredibly proud of all of you. Keep up the good work. And again, do this sequence 2 more times, or pick any sequence and do it 2 more times. I want you to get in the habit of doing a sequence 3 times a day to get the results that you desire. I wish you all the best. Be well, and see you back here tomorrow.